Welcome to this powerful and must-watch episode of HERcast with Dr. Chito. Today, we're delving into a topic that resonates deeply with so many mothers, yet remains shrouded in silence: perinatal and postpartum depression. Postpartum depression is often called a silent battle. Do you know why? Because so many women struggle quietly, hidden behind the societal expectation that motherhood should be filled with nothing but joy. But for some, it's a storm of overwhelming sadness, anxiety, and exhaustion. The reality is that postpartum depression doesn't just affect mothers. It impacts their bond with their babies, their relationships, and even their children's development. The silence around this issue is heartbreaking, but it doesn't have to be this way. By talking openly, we can reduce the stigma, create safe spaces for mothers to seek support, and inspire a shift in how we approach maternal mental health. Every mother deserves to feel seen, heard, and supported. Joining us today is the remarkable Fanan Yashi-Nyakan, a clinical psychologist and a champion for mental health advocacy. With expertise in cognitive behavioral therapy, called CBT, dialectical behavior therapy, DBT, and addiction treatment, Fanan has spent over 5 years helping individuals and groups achieve their best possible selves. As a member of the International Society of Substance Use Professionals, she's a trusted voice in mental health, frequently sharing her insights on platforms like Radio Maria Abuja and Armed Forces Radio Abuja. In this episode, we'll explore the causes, risk factors, and signs of postpartum depression, uncover the emotional pain and challenges it brings, and most importantly, share practical ways to overcome it. So, whether you're a mom navigating postpartum depression, a partner, a family member, or someone simply wanting to understand more, this conversation will empower you and to be part of the change. This is more than just a discussion. It's a call to action, to break the silence, end the stigma, and bring hope to every mother battling postpartum depression. So just make sure you stay tuned to the very end of the conversation. Welcome. I call you Dr. Fanan for short.
Thank you. Thank you so much for having me. It's really a privilege to be on HERcast.
Great.
Thank you.
I'm going to just dive into this because I know we're talking a little bit how actually the awareness has grown, and we're seeing more, people that even not only postpartum depression, other mental health diseases coming out and speaking up about their condition.
Exactly.
What are now like the primary causes of postpartum depression? How can mothers recognize that what they're experiencing is not their fault?
Okay.
Or don't laden themselves with guilt.
But the truth is, just like you rightly said, when it comes to postpartum depression, not so much is heard about it, not so much is known. So I'm really excited that, we're having this conversation today. So postpartum depression is actually a kind of depression. I know that, when you talk about mental health, a lot of people would be able to say depression is a mental health issue or a mental illness or, a mental health disorder. I'd also like to talk about, the symptoms, right? And then one of them was feeling guilty, like you said. So there's an excessive sense of, guilt. Meanwhile, postpartum depression is also a mood disorder.
Yes.
So it would definitely affect your mood.
Mm-hmm.
So for a lot of people, it's characterized by many, many lows. You're feeling low. And it's important to know that postpartum depression comes after one has had a child. A lot of people who know about postpartum depression know it as something that women experience after having children. You just put to bed, and this is noticed after, maybe like a week or, about a week, into the first year after having a child. So a woman can experience that, a man can experience, postpartum depression as well.
Men do?
Yes.
So
that's another. Men are actually, they also get to experience postpartum depression as well. Postpartum depression, like we're saying, women experience it immediately after having, children, and this is different from what a lot of people know as postpartum blues. But the hormones that have been spiked up during pregnancy, begin to calm down, and then this person can now start having these feelings of guilt. You're feeling low in mood. You don't feel like having anything to do with the baby at all, the baby or the babies, as the case may be. Someone experiencing this would have thoughts about harming themselves or harming the baby, and all of those issues.
From the OB perspective, sometimes, we always link, the mood change to what you were saying. I might as well say it here, to like progesterone levels or hormonal levels that occur during pregnancy. That sometimes, people will tell you, oh, a pregnant person is always like very irritable with you, or a little thing, they break down and start crying. And there's truth to that a bit, but when it comes to pregnancy, but people have linked that with having depression, because we talk about postpartum depression, but people also have to understand that depression can actually start in pregnancy.
True.
There's a significant number of that. And recognizing, and this question is important, because I think for mothers to understand, or people to, even partners of these mothers and family members, to understand what are the signs of postpartum depression is important. So for the main thing I would like us to address now is, what are those signs? What are those signs that a main person could look and say, look, maybe we need to screen for depression?
So we talked about some symptoms already, feeling guilty and all of that. But
mood change.
Most of these things the mother is experiencing, the people around may not be able to say that, this is what is happening. But one thing you can, say that this person may be experiencing postpartum depression is that they don't feel connected to the baby. They don't feel happy. It's usually expected that, a child has come, everybody is supposed to be happy. The mom is supposed to be all, happy and all of that, expressing joy and all. But then this, when it comes to postpartum depression, this is like the total opposite. So they want nothing to do with the child at all. So there's no connection.
Or even when you hold the child, there's the bonding.
Yes,
may not be evident. It's
not there.
There's a personality change.
Yeah, so there are different levels. Different levels of postpartum depression. Some are more severe than others.
Some can even lead to psychosis.
Exactly.
Get delusions and hallucinations.
Yes. So sometimes you may have evil thoughts about the baby. Probably this baby has come to take my life. And all of that.
So
all of those strange things. So another thing is insomnia. Insomnia is something that can actually also be a symptom of postpartum depression.
Okay, even if most new mothers suffer from not insomnia, but you hardly get to sleep with a newborn.
Yes, so that is different, right?
Yes.
So that's where you now say that there's a problem. So the mother would usually be tired, the stress of pregnancy, labor and delivery and all of that. And then after the child has come, they may be tired and want to rest, I need all the sleep I can get.
Yes.
But somehow they're not able to get it, even when, they get that chance.
They can't sleep. Okay.
Yes. So they're not able to sleep at all. So that's another thing to look out for. And in extreme cases, just like we're saying, there could be psychosis, hallucinations. The mother is talking to themselves or seeing things that other people can't see, hearing voices that other people cannot hear. Or they have, strong false beliefs about certain things. It could be anything at all. It could be anything really. So those beliefs are false and they are not.
They're unreasonable beliefs. They're not they don't make sense in that sense.
Exactly.
You know, but I will also add, I think one key thing for people to look out for is if someone was always a cheerful person, or someone was always positive about life, and all of a sudden everything
so there's a change.
Yes, they're not talking much, they're quiet, they're moody. I think,
and then they're not able to do the things that
they
are normally expected of them to do. Yes, and then the things that they used to like to do. Exactly. I think we talked about isolation before. So they want to be alone. They don't want to be have anything to do with the baby or the people around. They just want to be, you know, on their own. So appetite could also be appetite could also be affected as well.
Not easy.
So extreme feelings of guilt, you know, feeling like I brought this upon myself. I'm a bad mother. I'm a bad person. You know, all of those things are signs that there's something wrong. There's something wrong.
You know, I always try to tell my patients when I journey through their pregnancy that you're not doing this alone. Yes, you have your family, but know that I'm also in your corner. What would you, if I called you to counsel a patient, what would you say to a mom who feels isolated and unsure if what she's experiencing postpartum depression? Because like you said something about insomnia, and sometimes it's a vicious cycle. You have a new baby, you want to make sure you hear the baby, you want to sleep, you're tired. I know there's a way you can get so tired that you don't sleep. Like just like normally, like just even without pregnancy, you can work so hard, get so tired that you're tossing and turning in bed, you actually cannot sleep. And people that like to work later at night can know what I'm talking about. And so, but what would you tell a mom who says, I don't want people around me right now. I'm a people person, but now I want to be just on my own. And they're not sure, is this postpartum depression? I mean, most women starts experience what we call postpartum blues. And that's the low mood feelings that happen, you know, immediately after birth, but they normally go away by a week or so. Postpartum depression kind of remains persistent. I wanted to make that difference. But what would you tell a mom that comes to counseling telling you that, look, I'm just unsure what I'm dealing with here?
Okay. This is something that can happen to anybody. Of course, I'm not taking it in detail what I would say.
I want to take it in detail.
First of all, as a professional, you would want to do your assessment and be sure that, you know, sure of what you're dealing with. And then the truth is, most times when you do that assessment, you discover there may be also, you know, coexisting disorders or comorbid disorders like anxiety. They could be post-traumatic stress disorder. You know, they could be postpartum psychosis as well. So when you do your assessment is when you're able to say that, you know, this is what this person is dealing with. Whether you identified any of these issues with the patient or all of them, the truth is this is something, or any of them could happen to anybody at any time. So this is something that, you know, a new mother or a new parent, you know, needs to understand about postpartum depression. So you're not alone. That's the fact. This may be easy to say, but it's the truth. You're not alone. It's something that could happen to anybody, you know, at any time. And that's why we encourage support groups, you know, for people who have been diagnosed with this issue and have to go through treatment. Get help. You know, help is also very important, because most times this will come as a result of, you know, this parent is feeling overwhelmed. You know, there are financial issues to look at. There are just a whole lot of changes. And then for a single parent or a mother who is, you know, below 20 or, you know, really young.
Yes.
That mother themselves is trying to understand their own system, is trying to understand life, you know, and all of that. So when a baby now comes, you know, it's an added responsibility. So this could also trigger postpartum depression. So as much as possible, I would encourage this client or patient to get as much help, you know, as they need to. Studies have shown that about 1 in 8 women, you know, who have had children or just had children could experience postpartum depression. And then about...
That's a big number.
Yes, 1 in 10 men would experience, you know, this
I'm going to go research that one immediately I leave here.
Postpartum depression as well.
Yeah.
So yeah, so you're not alone. You know, we could walk through this, but you also need to be able to try to identify your feelings. This may not be easy, but these are the things that, you know, we do when we have constant therapy, we have constant we're consistent with our sessions, so we're able to walk through that together. So it's one thing to be able to know that you need help, and then also be able to accept that help that you need as well. So
that's very important.
Yes,
knowing you need help,
knowing you need help,
accepting
and accepting
the help
as well. So well, I don't know if you've seen it anywhere, but I haven't seen where someone got an award for, you know, this person has suffered most.
I know.
with children or the family and all of that. And then, you know, as women, it's really it can be difficult because there's that, you know, I want my home to be perfect, I want everybody to be fine, you know, and everybody is looking up to you, you know, somehow.
Pressure.
So and then it's easy to forget that you're also a human being, you're not a superhuman. You know, you also need to get help.
This is really important, especially for our side as people that manage pregnant patients, because I think the work, apart from other people, we talk about, oh, let other people become aware, but one of the things I feel in Nigeria that really needs to be talked about is that we need to get more active. You don't need to be a mental health professional to be able to start screening women.
So there's something called psychological first aid.
Yes, psychological first aid. Yes. So
anybody can actually do that, but of course you still need, you know, that training to be able to do that.
The first thing allows us to refer, you know, because yes, many people might not come and say, oh, may come and say, I'm fine, I'm good. But one of the things that I feel are very important is being able to identify those pregnant women and also those that have delivered, in terms of risk factor that this person, and one of the things this person may need to be seen by a mental health professional. One of the ways I do it, so I'm going to do this and toss it to you, but one of the ways I do it is that women that have gone through some trauma, and trauma either in conceiving, so women that this is now doing the OB side and I'll the psychological side, women that have gone through IVF, for example, because we throw the word IVF around, in vitro fertilization, but it's a huge emotional, physical and mental journey to go through IVF. People that have suffered even through their pregnancy, or early in pregnancy, something was found that was wrong, or something was found abnormal with the baby, and they have to carry and be followed closely. Sometimes even as bad as babies are found to have some problem, which if you tell the mom that by the time you deliver at the end, this baby will not survive outside your womb, and they decide I will continue with the pregnancy, that journey alone, then whether they have severe high blood pressure, they have diabetes, their baby is not growing. There's so many problems that happen in OB during the pregnancy that can put that mother at risk. And again, delivery. I have an emergency C-section. If I take a woman who has the mental thought that in their mind they're coming to the vaginal delivery, and all of a sudden they see themselves racing down the hall into the operating room, and we're explaining all these things and like, oh, we're going to do this, and the mother is like just traumatized.
Just a whole lot of thinking,
or they're bleeding and they have to do certain things, or they have children very early, so the baby is going to the NICU. These are, for me as an OB, very common reasons why most women would deliver and then have risk for postpartum depression. So what I always try to do is involve the mental health person in the beginning. Get that counseling in, get that, you know, you're fine by this one. I want the person to come, because they have a stigma, right? So I'm always like, I want this person just to journey with you, just to handle the stress over you, and then the more, when you say stress, I love that word stress. When you say stress, they're
because everybody's fine with stress.
and I hand them over to you, to guide them.
All of that.
So for you, is there any more, like from now the psychological point of view, is there anything more that we need to do more to identify these risk factors or risk factors that I may have missed or things that I should look for?
Okay, so I'm happy that you brought that angle.
Yes.
Because a lot of people do not know that trying to conceive or the gestational period of carrying a child can be really emotionally, physically involving. But I've not seen where you just look at a woman and say, you're going to have issues when you get pregnant. Talking about risks, that other risks, apart from those ones you've mentioned, that women, could be predisposed to having postpartum depression. If a mother has had a history, either a personal history of depression, it could be, just major clinical depression or even postpartum depression, because they may have had children before.
Yes.
They may have experienced, postpartum depression previously, or maybe the family where she comes from, there's a family history of depression. It could be any kind of depression as well. So family history, personal history of depression can also predispose a woman to having postpartum depression. And then when we talk about men, I like to talk about that too, because it's very easy to, just say that it's only the women that experience postpartum depression. So for a man who has also, had a family history of family or personal history of depression, is also at risk of this. Earlier on when we were talking, I talked about, co-occurring disorders. When we talk about post-traumatic stress disorder, also relating it to what you said. So if a person has experienced post-traumatic stress disorder in the past or during pregnancy, there's also a chance, they could come down with postpartum depression. Another thing is financial stability or instability, as the case may be. So for someone who is not financially stable, they could also be at risk of postpartum depression, because there's a chance of having to worry. Meanwhile, excessive worry is also a symptom of postpartum depression.
Yes.
So there's a chance you're excessively worried. How am I going to take care of this? How am I going to cope? How do I do this? And then this is also closely related to having a partner or not. So for a single parent, this could also be a big deal. It could also be an issue for them. So a single parent is also at risk.
Okay.
Yes, at risk. It doesn't mean that, because you're a single parent, you'd come down with postpartum depression, but that risk is there and is high too. And then we also talked about younger mothers.
Yes.
So younger mothers are also,
teens.
Yes, exactly. People below 20 or early 20s, thereabout. So they're also at risk of having postpartum depression.
Do you think that this all comes from like coping mechanisms? Because when we talk about teens, I think sometimes feel like I had my youngest teenager that I delivered was 13. And I remember the journey, I had to definitely involve a psychologist.
Yes.
Because she didn't have even the coping mechanism to go through the symptoms of pregnancy. And unfortunately, she was nauseous and vomiting and all that. So I used to think to myself that when they're so young themselves, they don't, it's so hard that it's impossible not to involve psychologists in the management of teenagers. Yes.
Yeah. So another risk factor could be, having certain expectations about childbirth. So I feel like I'm going to be this, I'm going to have it all perfect, and all of that. And when this doesn't happen, there's a chance that, you could start feeling low. And then feeling low is very closely related to inactivity. And then inactivity, there's excessive worry, something just keeps leading to another. So it's really, these are some risk factors that can be associated with postpartum depression.
So let's talk about now, how do we manage postpartum depression?
Okay.
How do mothers discover their inner strength? Emotional pain is sometimes worse than physical pain. I mean, like, I'm just in the sense, or whatever. I'm saying in the sense of not understanding how to treat the emotion.
Well, it can be a lot, because
so how do they? How can they get through this?
Okay.
Because postpartum depression actually can resolve. It does resolve. If it doesn't resolve, it goes into major depressive.
Okay.
Right? Or how does it work?
Okay, so first of all, there's the postpartum blues.
Yes.
Which will go away after some time.
Yes.
But then when it comes to postpartum depression, and then we also have a diagnosis.
Okay.
There's a very high chance that would not go away unless there has been some level of treatment.
Okay.
So it may be little, it may be, it may be short term, it may be long term, but treatment is very important. Now, before I go into that, emotional pain can be, is really, it may just be safe to say that it could be more than, physical, because nobody is actually saying what you're experiencing.
A silent battle.
Yeah, so you're the only person, so nobody is able to say, I truly understand how you feel, and that's another thing. As a professional, in medical health and all of that, you're also able to tell your clients or your patients that, see, I may not be able to understand what you're going through, but I know that this is something that is normal. So you're not dismissing their feelings.
Yes.
This is talking about how to approach someone who is experiencing this. So you don't dismiss their feelings. You assure them that, you're not alone. So when it comes to treatment, treatment is important. Remember that we said postpartum depression can come up anytime in the first year of pregnancy, which could start from as early as a week or two after the child is born. All of those issues can be there, but if they remain untreated and there's a problem, there's a chance they would go higher. Yes. And then your life is more disrupted. The bond between you and your child or your children, as the case may be, is also distorted, which could affect the child's development and all of that. But talking about treatment, is different for different people. So for someone who is experiencing a mild level of this kind of depression, they could do with talk therapy, which is psychotherapy.
Okay, yes.
So a lot of people are not okay with taking medications, but medication is also, a way of treating postpartum depression. So there's psychotherapy, there's pharmacotherapy, which is the medical part of it, where, a professional will prescribe medications for you to take so as to be able to elevate your mood.
Yes.
So you feel better, do away with those suicidal thoughts that may be present, which is something that is really, really common. It may be about harming yourself or, the child or the people around you, as the case may be. There could also be some hormonal therapy, and all of that.
Okay.
But really, yes, and then group therapy, which is
support groups.
Yes, support groups. Support groups also come in, is a form of treatment. So for some people, they may be more comfortable with support groups than actually talking one-on-one with a professional. So all of these are, different levels of treatment. But you can't treat yourself even as a professional. So
yes.
So I know that, most times we're tempted to, I know this, I know
the
this.
tools, I know what to use. I can figure this out myself.
Well, this person tell me that I don't know.
Yeah, but there's a difference, right?
Yes, there's a difference. So
I managed my own pregnancy, so I feel you.
Am I surprised? Okay, so but really, even as a professional, you also need help.
Yes.
You're not a superhuman, so you can also do with all the help that you can get. And when it comes to getting help, in addition to what we've said already, you can be creative with, the kind of help that you need. So someone else may be, trying to help out, but that's not what you need. You probably can do that better, and then there's another area of your life where you need more help, So So when it comes to getting help, you could be creative about the kind of help that you need. And then it's really okay to talk to a professional. You can't be too careful about how you feel, or the symptoms that you're experiencing and all of that. There's really no downside to being too careful or being proactive about your health. So it's okay to talk to a professional so that you're able to rule out, do I have this issue? And then if I don't, well, I've not lost anything. And then if I have, an issue like this or something similar, then they could also help me or refer me to the kind of help, that I need. Yes. So treatment is very, very, is very important. Now, also talking about medication, I know a lot of women or people may be scared, will this affect my baby and breastfeeding, and all of that. But then the professional knows what to give you.
That's what I always say. When we have no objective to hurt you or your baby, but we know that you need that help. You need a healthy mind to navigate the journey of pregnancy, and we're here to make sure we get that balance.
Yes, because it can get really bad. You could end up losing, those same things or same people that you're protecting.
Yes,
protecting in quotes.
Yes,
because this could result to violence, family violence. It could result to divorce.
Yes,
because a lot of men, what is your problem? Why are you acting out?
Yes,
why are you behaving like this? Don't you have everything you need?
Even family members, they'll come, you should be happy. And you know that we have also, I always say, even being a person of faith, that sometimes religion and culture
sometimes
does not allow you to navigate your way from being depressed to actually healing, because it ends up sometimes loading guilt on you. I know they'll tell you, I just pray. And as much as I believe in prayer, I also believe, I also believe that there's a journey you must take. There's a work you must do. And I always tell people when they say that, I said, God made doctors. I hope you know. we work for God.
Yes.
We're like the lifeboat that God has thrown to help you through the journey. So we're part of that answer.
That's probably a whole day's conversation. I
can tell you, there are major problems.
As much as culture helps, culture and spirituality helps, they also can be, disadvantages to us as well. So a lot of people would end up spiritualizing, the fact that the child is not able to, the mother is not able to bond with the child, for instance. This is evil. We have some village people disturbing us and all of that. But the truth is, you can't be too careful. Just like we said, you can't be too careful. So while you're doing the spiritual part, you can also do the medical part as well. See a professional. It could be a gynecologist. It could be, and then if they are not able to handle that, they can also refer you, or co-manage you, just like you do.
Yes. Now, the one thing we must address is the stigmatization, right? And I say it's important because there are many women who feel stuck, hopeless, and unable to see a way out of postpartum depression, when we know that there is a way out of postpartum depression, where you can get to the place where you enjoy your baby, you enjoy the gifts that God has given you, but they're stuck. And they're stuck because of the stigmatization of mental health, and now particularly postpartum depression. How can we reduce the stigma around postpartum depression and encourage moms to speak up and seek help?
Okay, so when it comes to stigma and, getting out of it, it's an all hands on deck thing. So everybody is really involved. Everybody has a role to play, because I could say that everybody around me should not look at me this way, look at me some kind of way, like I have some, strange illness that has fallen from the skies. But then how do I look at myself? So there's something called self-stigma as well. So everybody, so everybody has a role to play when it comes to stigma. And sensitization helps a lot. So if I know that, this is an illness, this is what is causing it, where in the scientific era where we have a lot of, scientific explanations for a lot of things, where we're talking about hormones, we're talking about neurotransmitters being able to change mood and behavior and all of that. So if we're able to understand that better, and I'm happy that, there's a lot of work being put in, even for people who are not mental health professionals. So they're able to understand better now. They're able to advocate, they are mental health advocates. They're able to say that, mental health issues should not be spiritualized, and all of that, or it's not a sign of weakness or any of those things. So
like having physical health issues.
Yes,
really
exactly.
On the same level, yes.
Yes. So it's like having physical health issues. So everybody has a role to play, but sensitization helps a lot. So if I understand better how this is happening, or if I have a different explanation from, the spiritual explanation, so I'm able to, empathize with the next person better, empathize with myself, and empathize with, the person next to me who may be experiencing this issue. So it's important to know that while you're stigmatizing another person, this is something that could happen to anybody, at any time. So you need to, we all just need to be accommodative of every other person, including ourselves as well. So stigma, sensitization is top on the list. Yes.
Can I add something as well? And I think I always love talking to professionals, and I'm sure when you guys have your meetings among psychologists, I'm sure that these are one of the things that come up. I feel that our healthcare professionals in our climb should be proactive about using the screening tools that we have to be able to identify women that may need more help in whatever we don't. And I think if we go to the office, I always do this when in Tabitha or Arabella, one of the things I do very significantly is if you're pregnant, you will take that Edinburgh. I still use the Edinburgh Postpartum Depression survey. If you have a baby, you come back. If it's a C-section, you come back in 1 week for me to check. Every time you come back to see me in the following 3 months.
So mental health is incorporated.
So mental health is incorporated as your well visit, as your prenatal visit, as your postpartum visit. And one of the things I try to get people to do is to let's make this a policy. Let's make something like a protocol that this, in the Western world, I practice in the US as well, and this is part of what we do.
Yes.
Do you understand? We screen, and even sometimes people will come and they pass it, but even looking at, we're down here, they don't want to get help, and you say, okay, this is your score 9 on this scale, then, or 10, and they come back and like, you're now a 6. I'm worried. Do you see the decline? Most times they look at you and say, I am not doing very well. I'm not coping very well. It even opens them up to see the reality of their situation. And then I now refer to the clinical psychologist to say, look, I do, of course, psychological first aid. I may start them on something, especially if they're at risk of hurting themselves. So if I don't get that day appointment, I'll start you on this. But when you see the psychologist, they will start the main treatment and adjusting. Yes. I think the psychological, like clinical psychologists, should try to really put that and try to get other healthcare providers to make it part of in the government hospitals, private hospitals, clinics. It's very important because that will break stigma as well.
Yes, because there's a lot of family practitioners, for instance, GPs, who do not know what mental health is or what to look out for. Yes, because when you know what to look out for, you know when to refer. Yes. So it's really, I agree with you. We have been doing a lot of work, but there's still so much work to be done as clinicians or mental health professionals, as mental health advocates. There's really, really more to be done when it comes to sensitization. So everybody knows, everybody is aware that, see, when I'm experiencing this is where I need to go to, or this is where I should be referred to, or this is where I should refer someone to. So truly, I encourage more collaborations, maybe between NACP, and the Nigerian Medical Association,
yes,
and all of that. So we're able to work together, because truly no one can work on their own.
That's what I'm saying.
So yes, so no one can work on their own.
Very important,
and nobody is more important, than the other person. So everybody just has their role to play.
Definitely.
In making sure that everyone is doing better, everyone is fine.
I must say that if you're out there and you feel you may not be coping properly, or you just had a baby, or you're going through the journey of pregnancy, or in the journey of trying to get pregnant, and you feel you're not coping, you are not alone. If you have any questions or you want to reach, there's a number that you see below the screen, and also you also see our other contact details or social media platforms that you can send private messages to as well. It's very important that the silent battle shouldn't be silent, because there are people available to navigate this and take you through it. And I'm so grateful that Dr. Fanan could come today to be able to take us through what we need to see, how we can identify it, what are the risk factors, and really talk to us about things like managing, how we manage it, and just giving us a good lesson on postpartum depression. There's going to be more episodes on this, because I'm determined to break the silence and to also break the stigma around mental health issues. So as we come to the end of this deeply meaningful episode, I want to thank you for joining us on this journey to break the silence around postpartum depression. Now, to every mother that's listening, your strength is extraordinary and your voice deserves to be heard. You are not alone, and help is always within reach. Let me leave you with this. This is your year to climb, to break barriers, and to shatter the limits we often set on ourselves. At HERcast, we're here to help you overcome challenges, gain knowledge, and thrive. With every episode, we aim to inspire boldness and transformation, helping you embrace your authentic self and reach your full potential. Our tagline, remember that: her strength, your inspiration. Keep being audaciously you, unapologetically, fearlessly, and beautifully. Listen to us now on Spotify, Apple Podcasts, and Google Podcasts, and other popular podcast platforms. Watch on YouTube, HERcast with Dr. Chito. Follow us on our social media platforms at HERcast Podcasts, at Dr. Chito N. Catch us on Rapid TV, channel 176 Startimes, Saturday at 7 p.m. and Sunday at 2 p.m. Until next time, I'm Dr. Chito, reminding you to live boldly, lead with heart, and keep pushing for the change you want to see. See you on the next HERcast. God bless.